Good morning, everyone, and welcome. My name is Dr. John Given. I'm a member of the Levy Senior Center Foundation Board, and I want to welcome everyone here in person and send a welcome out as well to those who are joining us remotely. This is a lecture which many of you may know is part of a long legacy of programs provided here at the Levy Senior Center through a unique cooperation between the City of Evanston and the Levy Senior Center Foundation. The city maintains the overall structure, the staff, and so much of the infrastructure. The Levy Foundation is a philanthropy board which looks for ways to supplement and fill in any gaps of programming or needs of the center on behalf of the seniors in our community. It's really a tremendous cooperation between many individuals. I've never seen it before, and I think it's just the most wonderful thing. Just a brief personal note, I remember when I moved to Chicago 2 years ago, I had a big void in my life and I was looking for a way that I might fill. And so I visited a number of community centers and facilities. Snooty or dilapidated was the two extremes that I saw. And I remember walking in the door here, entering the lobby, and I immediately felt like I would just been given a hug. Such a balance and such an atmosphere of nice. And we owe a great deal of gratitude to all the people who work in the Levy Senior Center Foundation, the Levy Center itself, and the Levy city, and the City of Evanston as well. So we're welcoming today Dr. Debjani Roy. She completed her medical college training in India, came to the United States and completed a residency in internal medicine, and then went on to complete a fellowship in integrative medicine, which really embodies a perspective in healthcare that it's sorely needed. If we generalize Western medicine, we can all be thankful for the technology and the benefits that have come. Yet in that pursuit, some of the humanity and much of the wisdom and knowledge that can be under the category of Eastern medicine has been ignored. And physicians and providers like Dr. Roy represent a much needed enthusiasm and introduction of that approach. She describes it as salutogenic. Salute from the Latin meaning greeting, acknowledgement, genic, growth, creation. So it's really so important to acknowledge the benefits of Western medicine, but be open-minded and greet the concepts and the wisdom that are represented in, let's call it, Eastern medicine. In her practice, she emphasizes well-being, not just disease, but overall well-being. She refers to phrases like food is medicine, with a special interest in pain management, herbal medicine, and autoimmunity. Really a devotion to the whole person and not just the single disease or condition that might fall into this niche or that niche. In addition to her clinical practice, she teaches at the Chicago School of Medicine, Rosalind Franklin University. And we are thrilled to have her today. Dr. Roy.
Thank you so much for this great introduction, and good afternoon, everyone. I'm really excited to present our integrative approaches for chronic pain, and I'm going to try and answer some of the questions that have come through some of the slides. I specifically made some of the slides for all of you. Further down. Oh, thank you. Next slide. Next slide. So this is, our main topic is integrative approaches to chronic pain. Thank you. It's okay? So this is our agenda for today. I'm going to go over the overview of chronic pain and some insights into nutrition, movement, some mind-body modalities, some insight into red light therapy, and also a section on the role of cannabis. So chronic pain, as all of you know, is incredibly common. It is estimated that about 100 million people live with some form of chronic pain. And the consequences are many. It affects your activities, relationships, and your emotional states. And for society, it is also a very big burden. It shows up as loss of work productivity, increased healthcare costs, and also elevated disability costs. And the treatment, as many of you might know, remains a challenge. And pain can be localized or at multiple sites. So you can have pain in certain areas of your body, or it could be a whole body pain. It could be very localized to a joint, or it could be something in the nerves or in the muscles. So it varies with every individual. And the pain experienced, we now know, is influenced by the person's psychology and also the emotional experience that they've had. So I'm going to go over a little bit about the types of chronic pain. There are many types of pain, but some of these are the cause of chronic pain. And the first one is called nociceptive pain. So these are usually arising from damage to tissues like your joints, muscles, bones. It feels like a dull and throbbing pain. And some of the examples are osteoarthritis, inflammation in the joints, if you've had any injury. Sometimes when you have injury to a joint, or if you've had like a fracture, or if you've injured any part of your bone, you sometimes develop what is called a secondary osteoarthritis, and that can give rise to chronic pain. The second pain is neuropathic pain, and this is usually from damage to nerves, and it's usually described as burning or a shooting pain. So if you have, say, diabetes, you can develop this kind of neuropathy, or with shingles. It can be a very painful experience. And sometimes with all the spinal cord injuries, you can develop neuropathic pain. And the third section is cancer pain, which is caused by the tumor itself when it presses on a nerve, or it could be a result of the treatment, such as chemotherapy. For headaches, the most common chronic pain is our migraines. And I think most people know how bad it can be and can disable your life. And lastly is visceral pain. This pain originates from your internal organs. Say you have kidney stones and you have chronic kidney stones, or even irritable bowel syndrome where you're cramping. And I will come to all the stressors which might lead to that. Next slide. So I just want to, before I go into the integrative management, this is a slide shows our World Health Organization stepped pain management. You can see there's a side A and a B. There's a little bit of difference between the two sides, but all of them, as you can see in step 1, shows non-opioid management with adjuvants. So Tylenol, any of your anti-inflammatory medications, your pain patches, gels are usually the first line. And then if it's really worsening to mild or moderate pain, then they do add opioids. And then step 3 is again adding more opioids from moderate to severe pain with the non-opioids and the adjuvants. So this is more of a medical management. And as you can see, there's not too much concern about the other issues that might be causing this pain. And then there is an additional step. It's called the interventional step in this ladder, which suggests invasive and minimally invasive treatments. So many of you might know about steroid injections or placement of a spinal cord stimulator. So this is how traditional medicine would manage pain. But I'm going to talk about some of the integrative approaches to manage chronic pain. And I'm going to go through some of the topics that I discussed in the agenda. So I'll start with nutrition, movement, some supplements or topicals that you can use, some mind-body modalities, which is Tai Chi, yoga, meditation, mindfulness-based stress reduction, and then a little bit about physical therapy and the use of red light therapy or laser therapy for healing. And manual therapy, as in osteopathic manipulation, massage therapy. This massage therapy is very important for patients who have fibromyalgia. And then we'll talk a little bit about acupuncture and lastly on medical cannabis. So with a nutritionist, this is Andrew Weil's pyramid. It's an anti-inflammatory pyramid. And it is very much related to the Mediterranean diet that we talk about. And the basics are emphasis on fruits, vegetables, and whole grains, olive oil, nuts, limiting dairy and meat products. So if you see the pyramid, the base is always all the vegetables. So the colored vegetables, fruits, preferably more berries, and then whole grains, healthy fats. So healthy fats is the tier 3. You can see walnuts, pistachios, almonds, really good oils. So if you have like a handful of nuts every day or add it to your salad or your yogurt, it's very beneficial fats. And then we come up to fish. And we really recommend oily fish. And the main ones are salmon, and then mackerel, anchovies, sardines, herring. It's really and if you can't get all of these fish, salmon would be great. Wild caught would be the best. And the best oils are right below the skin. So make sure you cook the salmon with the skin on. And then going further up, we have whole soy food, such as edamame, soy milk, nuts. Mushrooms are really anti-inflammatory, they're anti-tumor. And when we talk about mushrooms, we really focus on mushrooms, yeah. Wild caught. Wild caught. Yeah, if you can't get wild caught, farm raises is okay. Yeah. And so the mushrooms, so the really good mushrooms are the shiitake or the maitake mushrooms, really anti-inflammatory, anti-tumor. And then, of course, we have other sources of protein such as eggs, cheeses. And then going beyond that, we really recommend healthy spices instead of salt to flavor your food. So all our Mediterranean herbs are really good. Rosemary, thyme, oregano, very anti-inflammatory, really good for you. And you can use these to flavor your food instead of adding more salt. And then, of course, tea. Green tea is really good for you, helps burn fat. And then supplements, which I'm going to discuss a little later. And of course, we do suggest red wine. It does cut out the fat if you're eating meat, red meat especially, but usually 1 glass per day would be the maximum. And then we're really trying to cut down more on dairy and sweets. So, but if you have dark chocolate, that's really good for you. It's anti-inflammatory too. And so, like I mentioned, this anti-inflammatory diet can affect your pain through improving mood, energy levels, improves energy levels, sleep, maintaining a healthy weight, and also reducing inflammation, which is key for pain. And the omega-3s, like I mentioned, found in salmon, walnuts, and also the seeds, pumpkin seeds, flax seeds, are really anti-inflammatory. And all the fruits and vegetables, they have what we call phytochemicals, and that also helps with inflammation. And lastly, the spices, as I mentioned, are all anti-inflammatory. Next, I'm going to come to movement. And there's always the traditional exercises such as walking, biking, swimming, your strength training, and specifically joint-specific flexibility program. They all help you move and stretch. And then I would like to talk a little bit about this yoga, tai chi, and qigong, which also have mind-body modalities to it. They have some breathing components to it, make you more mindful, and helps you focus. These are all slow movements, but they all help bring down your inflammation and also help stretching. So these are some of the Eastern medicine movements that you can try. And there is no really specific exercise program which is the best. Your exercise prescription, through your doctor can help you with that, should take into account your functional status, your mobility, what your treatment goals are, and what you're interested in. You know, if you don't like doing yoga, then you don't want to do yoga because you're not going to do it. So you want to have that discussion with your physician and then come up with some kind of a fitness and a movement plan. I just want to go over the slide. I really like it. It's kind of a difference. It shows a difference between yoga and Tai Chi, and I've had a lot of questions about these modalities. So as you can see, yoga was, it emerged in India 5,000 years ago, whereas Tai Chi is more based out of China. And with yoga, you'll see the poses are held for a certain amount of time. They hold the positions for a certain amount of time. While Tai Chi is always a fluid motion, you're always moving. Yoga can sometimes be physically demanding, so you want to make sure you're not doing certain poses which might be detrimental to your joints or your spine. So you have to be a little careful with the yoga poses. Tai Chi is more of a lower impact exercise, and everyone can do that. And then both these modalities, they do align with your breathing. Both of them do that. Yoga is usually performed in a non-standing position. So you're usually on a mat. So the boundary is your mat, and you're sitting or moving in that boundary. While Tai Chi is always usually is always done in a standing position. And Tai Chi is actually a martial art, unlike yoga. So that's one of the differences, but it's not that it's violent, but it is a martial art. And again, the mat is the boundary for the yoga, while here the world is your boundary because you're moving and standing and moving in different positions. And both of them help with stretching. With yoga, you're stretching to relax, and in Tai Chi, you relax to stretch. So there's just a little bit of subtle difference there. Yes. So I would like to talk a little bit. There's so many supplements now, but these are some of the important ones that I wanted to discuss. So the first one is the omega-3. If you're eating fish, you're getting, or the nuts and seeds, you are getting omega-3s. But if you feel that you don't like fish, or you're unable to get the omega-3s in your diet, then supplementing with omega-3s would be a good idea. Again, you have to make sure it doesn't interfere with any of your other medications. but that would be something to supplement for chronic pain. Vitamin D is very essential, and our Midwest, we get so little sunlight, but vitamin D does modulate pain and also your immune status. So it's good to have the levels checked, make sure you're not overdosing on it, but that the levels are optimal. And then we have two interesting ones. It's the devil's claw and the willow bark. These are supplements which work very similar to our non-steroidals like Aleve or Advil. It works similar to salicylates, and they help with pain. And then, of course, I think most people know about ginger, very anti-inflammatory. Ginger chews, adding ginger to your beverages. And then turmeric, very anti-inflammatory. You can add it to your beverage, use it for cooking. So in India, we use turmeric for cooking, but you can definitely get really good supplements. And there's several nutraceuticals that have this turmeric. I just have to make sure that it's a very pure form and that's not mixed with other contaminants. The glucosamine chondroitin, I think a lot of people are aware you can get it through all our pharmacies. It's really good for knee pain. So that would be one of the options. And then, of course, topical capsaicin, which is it's like pepper, right? So it's anti-inflammatory. You can apply it wherever you're having the pain. The only thing is you have to make sure you wash your hands really well and don't touch your eyes. So these are some of the other options. And of course, medicine, you have a lot of options from topical Voltaren gels to topical lidocaine gel. These are anesthetic, but those are more medicine, while these are more integrative supplements. Next slide. I just wanted to go with a cycle of pain because I think there was one question about how anxiety and depression and pain can be related. So this shows where you have chronic pain, that's a dark green arrow, causes you to have decreased activity because of that chronic pain and deconditioning. And that leads to avoidance of activity or exercise and also withdrawal away from, exercising and moving, going out. This causes some negative emotions. You start feeling depressed, or you're not meeting people, you're unable to move or go out and socialize. And that causes more increased pain perception and worsens the pain. So as you can see, if you keep moving, it does have an impact on your mind and your body, and also improves your pain perception. And that finally does lead to help with dealing with the chronic pain. And then talking about mind-body modalities, these are the ones I've suggested, and there could be many more, but meditation has shown to really help with chronic pain. And I'm going to show us another slide with some of the reviews. But it's meditation and mindfulness-based stress reduction helps grow some of the networks in our brain and helps with pain perception. So that's really important. And meditation could be many different types. It could be meditating in one spot, or it could be, walking meditation, where you're meditating while you're walking in nature. So that's a very important modality for chronic pain. And then, like I explained, yoga, Tai Chi, and Qigong, these are all mind-body modalities which help you stretch, breathe well, and focus and become more mindful, which finally leads to healing from chronic pain. And then walking in nature, some are, like I mentioned, walking meditation, forest bathing. You'll see some of our park districts or even the Botanic Garden, they have classes doing forest breathing or walking meditation. So those are good ways of doing. And it's really, so when you're walking in nature, you want to focus on your steps when you're walking and then focus on your breathing. It's not very complicated, but it's just becoming more mindful of what you're doing while you're in nature and appreciating your nature. Yeah. Forest bathing. So it's a concept that the forest is bathing you with its leaves and shadows. Yes. Yeah. So, um, and then, of course, listening to music, whichever type of music you prefer. There is and I wanted to bring this up for all of you. It's called the Sound Health Network, and you can check this site out. They have a lot of research going on with University of California, San Francisco, and their focus is to promote research and public awareness about the impact of music on health and wellness. It's a very interesting site. You can go in and see all the research that is being done. There's a lot of evolving research that's going around. And then, of course, artwork, any form of art, painting, sculpture, painting by numbers gets you focused, and you can do it at home. Um, and then lastly, journaling. This is a really good way of becoming more mindful, and it does help with chronic pain. So when you journal, make sure you don't lay too much stress on the spelling or what you're writing. You just have to keep writing. So you don't want to focus on your spelling mistakes or your grammar mistakes, and that's how you kind of decrease your stress. So I wanted to, like I was wanted to discuss a little bit more about mindfulness-based stress reduction. This has shown to have short-term effects on your pain intensity and also your physical functioning. There has been a systemic review, which was published in the Annals of Internal Medicine in 2017, and they actually suggested MBSR as one of the first-line treatment for chronic pain. While many questions remain unanswered, a review of literature shows that there's evidence of changes in the brain networks relevant for understanding these processes associated with mindfulness. And the main areas are your frontal cortex, which front of the brain, and also it's the insula, the amygdala, and also changes in the hippocampus. These are all in the temporal lobe, which is like the sides here. And it has shown that in imaging, like MRIs, how these change, how all the mind-body modalities have actually, and especially mindfulness-based stress reduction, causes these changes. It's still an evolving research, but hopefully we'll be getting more studies on these. So this is what I was discussing. I just wanted to bring up the picture of the brain. So mainly the frontal lobe, the temporal lobe, these are the main areas that are actually shows these changes, new networks, enlargement of the hippocampus. So this is just an idea of where things are processing. Okay, so now I'm going to go into what we call complementary therapies, and mainly manual therapies and acupuncture. And I'm sure all of you have tried something or you've heard about these. So the manual therapies, they share a common goal. They want to normalize your structure in order to improve your function and improve pain. So these are usually done by chiropractors, osteopathic physicians, physical therapists, massage therapists. And as in massage therapy, you see there's high velocity, low amplitude thrusts, there's strain, counter strain, myofascial release, and craniosacral therapy. These are terms, but this is how they stretch and try to normalize the structure. And then acupuncture, which works very well for pain. It's amazing how well it works. So the way it works is where they needle at the acupuncture point, they call it, it stimulates your natural endorphin system, which alters your pain sensation. It also releases certain chemicals such as interleukin, substance P, and adenosine, these also influence your pain. So I just want to tell you that usually one session doesn't do it. It's cumulative. So the more sessions you do, the more benefit you'll have. So just to keep that in mind. And it's very important you really relate with the acupuncturist because it is a mind-body modality. So a lot of things you have to just keep in mind to get success out of doing acupuncture. All right, next slide. I just want to talk about red light therapy, and this can be done by your physical therapists. Some of them do laser therapy, and they also use red light therapy. You can get the red lights now over the counter too. So it's basically infrared light and how it impacts our tissues and help healing. So this type of light has distinct interactions with our biological tissues and has a lot of impact on how they help with pain. It helps counteract oxidative stress and enhances circulation. So a lot of our pain is from oxidative stress, we call, and it basically helps damage the tissues. So this red light therapy helps with that. And it also helps regeneration of the damaged tissues, helping with the pain resolution. So as you can see, there's 3 wavelengths of infrared light, and each one has some specific ways they can help. So the near infrared, which is the lowest in the spectrum, they penetrate deeply into the tissues and promotes wound healing, skin health, pain relief, and reduction of inflammation. This is very commonly used. Then we have the mid-infrared. These are beneficial really for chronic pain and musculoskeletal disorders. And then lastly, we have the far infrared. These help with the detoxification and improve circulation. So the more blood flow there is to your tissues, the better healing you get. So this I've taken, you can also go into, it's called the Institute of Personalized Medicine. They have a lot of information about red light therapy. Actually, you can go back. So if you can, that's the link there, yeah. pmliinstitute.org, yeah. Okay. And lastly, I'm going to come to medical cannabis as there was several questions related to it. So I'm just going to give you an overview first. So cannabis is commonly known as marijuana, and it comprises of 400 compounds. And some of these are flavonoids, terpenoids, and the cannabinoids that we commonly know. Among these, the cannabinoids, they have the active ingredient or chemical which contribute to marijuana's overall impact. And our primary cannabinoid is THC, so tetrahydrocannabinol, which is responsible for the psychoactive effects sought by recreational users and also those who are looking for therapeutic effects from the drug. So the primary indication for medical cannabis is to relieve the symptoms rather than cure any underlying medical conditions such as pain. So you're using it to help get relief from pain, but you're not actually curing your osteoarthritis or fibromyalgia. Okay. So I just want to talk a little bit about this endocannabinoid system. This is how the cannabis kind of works. So there is a lot of ongoing research as to the mechanism of action of this cannabis. And it has been shown that there is cannabis receptors both in the brain and in your peripheral tissues. And it's called the endocannabinoid system. It regulates your metabolism, appetite, your sugar control, your immune response, and your sense of reward. So there's two types of receptors. The first CB1 are located in the central nervous system, and they help release the neurotransmitters such as norepinephrine, dopamine, serotonin, GABA. All these have some impact on pain, on your mood, whether you have anxiety or depression. And then the CB2 are located in our immune system. And this modulates our immune response and our response to inflammation. So both the receptors can help with pain, with chronic pain. So the medical uses of cannabis, I'm going to direct you to this website. It's by Department of Public Health, Illinois. They have several listings of what conditions can be used, can be medically certified for cannabis use. So it's very important before you start that you do review this website. It has a lot of information for you to go through. And then medical marijuana lacks the FDA approval. However, CBD was the first FDA-approved drug containing a purified substance of marijuana. So I know might be a little complicated, but I'll just go through how cannabis goes through our body. So it's usually metabolized in our liver, and usually when you're inhaling marijuana, the concentration reaches the blood, peak in the blood, in 3 to 10 minutes. While if you're taking it orally, it takes a little longer, maybe 1 to 2 hours. So if you're using these products, you want to keep that in mind, how soon it will work or not. And then the THC, it rapidly penetrates the brain and the muscles. It is eliminated through our bowel movement and to the urine, but mainly through the feces. Typically it is smoked, but we have several forms available for use. We have lozenges, we have patches, sublingual tablets, suppositories, in addition to being inhaled. There was one question about CBD and THC, and so I put the slide up. This is from Mayo Clinic. It shows the difference between hemp seed oil, CBD oil, and cannabis oil. So the main differences I'm going to point out. So the hemp seed oil is from seeds, while the CBD oil is from the flower and leaves of the hemp plant. And cannabis oil is from the flower and leaves of the marijuana plant. So there's a little difference from where the source is. And then the THC levels, you'll see there's none in the hemp seed oil, while for the CBD oils, it's less than 0.3%. And the cannabis oils have greater than 0.3% dry weight. And this is why you'll see that you have more psychoactive effects from inhaling or using THC. And then the uses, as you can see, hemp is used as a nutritional supplement. It's used in clothing, fibers. CBD oil does have medicinal uses as CBD oils without the psychoactive effects of THC. And then, of course, the THC, which has several uses. So some of the contraindications, these are the really known ones, and the important ones is if you're hypersensitive to cannabis, you don't want to take it. If you have certain allergy, if you've experienced allergies, you don't want to take that. Importantly, if you have cardiovascular disease, especially if you have severe heart failure, a very poorly controlled blood pressure, or irregular heart rhythm, it does cause an increase in your heart rate, and also it causes low pressure. So those are things to keep in mind, especially if you have any cardiac history. And then, of course, patients who have any kind of psychotic disorders, patients aged 8 or younger, and in pregnant or nursing women, you don't want to use cannabis. So, and then some of the warning and precautions, these are not contraindications, but it has shown that when you inhale cannabis, if you're immunosuppressed, it might cause you to develop a superimposed infection, like a fungal infection like aspergillosis. You have to be wary about what medications you're using, specifically with patients who use valproate acid, like for seizures. You have to monitor the liver functions. And then seizures have been seen with this particular dronabinol, and where you have to discontinue the medication. And then polysubstance use is higher in patients with a background of substance use disorder. So you and your physician needs to go over your history and the medications you take, and then make an informed decision about whether you should go on cannabis for pain. Okay, these are the references I used. You're welcome to explore those. And this is our integrative group in Glenview. We are at the Park Center. So this is our whole team. We have acupuncturists, we have physical therapists, and also we have massage therapy. It's a really nice team that we work with all our other physicians at Endeavor. And thank you so much for listening in. Thank you for your time.